Obstetric fistula is one of the most serious and tragic childbirth injuries. It is a hole between the birth canal and bladder or rectum caused by prolonged obstructed labor without access to timely, high-quality medical treatment. It leaves women leaking urine, feces, or both, and often leads to chronic medical problems, depression, social isolation, and deepening poverty. Its persistence is a sign of global inequality and an indication that health systems are failing to protect the health and human rights of the poorest and most vulnerable women and girls. This was a submission at the opening ceremony of this stakeholder meeting.
If women come to the health facility, for example, and they need a surgical operation, and the health system is not ready to provide the operation that they need, and they have obstructed labor, they will end up with obstetric fistula. So the health system is very important. Strengthening the health system is key to ensure that we prevent fistula from occurring.
The health system financing in this country makes it imperative for people to spend so much out of their pocket when they are accessing health care. And people with VVF are already very poor people. They are the marginalized, the disadvantaged of the society. These are women who are least empowered in third world countries. So that's a very major stumbling block. But I think if we look at the importance of women and the relevance of women to the family, to the society, we cannot say we have an option but to do something tangible about the circumstances. And one of the things I would suggest, apart on the side of treatment, access, carrying backlog, restoring hope for women who are already affected, is that access to the facilities where the skills are available.
It is not just the Fistula project that will prevent fistula from happening. It is a maternal health crisis that we have in Nigeria. And so all hands are on deck. You look at the primary healthcare centers, you look at the community health facilities, you look at the general hospitals, you look at the availability of surgeons, availability of skilled manpower. You look at all of this and you can see clearly that the challenge is much.
They also advocated a stoppage to early marriage as a woman's body system needs to be matured enough before pregnancy could take place.
Ensure that women have access to the maternity care that they need so that they don't develop complications, that women also have access to family planning services so that they don't unnecessarily get pregnant when they don't want to, and that young people do not get married off too early before their bodies are mature.
It is estimated that more than 2 million women in sub-Saharan Africa, Asia, the Arab region, and Latin America, and the Caribbean live with fistula, and some 50,000 to 100,000 new cases develop annually. Yet fistula is almost entirely preventable, as it can largely be avoided by delaying the age of first pregnancy, the cessation of harmful traditional practices, and timely access to obstetric care.